Welcome to Mommy Heal Thyself. We feature guests who provide you with the tools, resources, and strategies you need to say no to a life of pain and suffering from all forms of preventable disease, toxic drugs, and unnecessary surgeries. We hope to inspire you to boldly reclaim your ability to heal and to serve the ones you love. Welcome, everyone, to another episode of Mommy Heal Thyself. Today, I have two fantastic guests, because we are going to be talking about creating a parallel directory of credentialed healthcare providers that focus on health and nutrition. You know, we've been having a lot of discussions lately. In fact, last night, if you were a part of our Doctors Are In, you realized that we continued that theme of talking about creating a parallel system, because many of you are connecting with me and saying, well, Michelle, we don't trust our doctors. We don't want to go along with this healthcare program. We don't like the insurance companies. So what do? Well, today's guests are going to talk about something that they're doing to help us in creating that parallel system that many of us can now shift over into. I have with me Dr. Stephen Petrosino and Jackie Frederick. They are both retired military. Hoorah! Yay! My son is in the Marines, and we are also Navy family. So, I love you both, and thank you for your service. We just celebrated Veterans Day. In any case,
thank you.
I digress. In any case, Stephen has a long, distinguished career in the pharmaceutical industry as both a clinical scientist and pharmaceutical consultant, retiring in 2022. These roles have helped him have a perspective that is unique and balanced on both traditional allopathic medicine in terms of drug and surgical therapy, as well as nutritional preventative medicine. And Jackie is coming to us from the Air Force. She's working together with Steve to create a nationwide team of credentialed experts to beneficially impact the health of our clients and customers through an emphasis on holistic nutrition. So, welcome, you guys. How are you all doing today?
Yeah, thank you, Michelle.
Doing well, just sipping on my bone broth.
Okay, I hear you. Did you make the bone broth yourself?
Not this time, but yeah, sometimes I do.
Yeah, you know, I live out here in the country, so sometimes my neighbor goes deer hunting, and I tell him, keep the deer bones, and he gives me deer bones, and then I make this huge pot of bone broth that I can, freeze into batches, and it is the best, I tell you. In any case, tell us a little bit more about this directory that you guys are creating.
Well, Steve, I'll start off just by saying how we even got together. So the two of us met doing a fellowship with Children's Health Defense. So if you're not familiar with the website, it's a very good resource on all sorts of things that are toxic in our environment. But us being retired military, we both kind of connected over all the brevity and all of the weird words that we say. We understood each other. Nobody else did. So we kind of came together, and we both basically blocked the whole vaccine mandate, and therefore already were in the mindset of the natural way of healing. And so I'm not getting paid to do any of this. This is all because I believe in what Steve's doing, and creating that parallel society, if you will, of a directory of information. Because I will tell you that my son, he was stung by hornets and had almost an anaphylactic reaction, but it wasn't quite. He was able to breathe, but I know that with each additional hornet bite, it gets worse. And so I was searching out natural allergy related doctors to help either build his immunity or detox him. I couldn't find anything, nothing. Wow. And so when Steve brought this idea up, and he can speak to how it came to the idea, but when he brought it up, that's when I said, yes, sir, I will help you. And so we're really still working on trying to bring in as many credentialed advisors as we can. It's been a tough road going because nobody likes to just cold call on them. So it's really about the network. It's about the group of people you're reaching through this video, but it's also about those that you know, and then your friends know, et cetera, because that's the only way we're going to build this network is through personal face-to-face interaction, whether it's on Zoom, obviously, Zoom interaction. But in any case, it's got to be a network that we build, because cold calling it doesn't work. And so Steve can speak to how he got here from 1996. It's been a long road coming. So that's my piece.
Thanks, Jackie. Well, yeah, Michelle, essentially, I launched my original website, as Jackie mentioned, back in the 1990s. I think it was 1996.
Wow.
And so it's my website's nutritionadvisor.com. However, I'm in the state of Ohio, which has one of the most restrictive requirements for nutrition counseling in the nation.
Wow.
Essentially, even though I've got a doctorate in clinical nutrition, I would need to charge for my services to have an RD, to be a registered dietitian on top of that, which then again limits you to what you can recommend. For instance, a registered dietitian cannot recommend over the minimum daily requirement of vitamin C. Used to be 60 milligrams a day. I think it's been recently revised all the way up to 90 milligrams a day. So if you are making recommendations outside of what are the parameters, you can actually lose your credentialing. So I never became a registered dietitian. I actually looked into it for a period of time in the 90s. And what was required was that I would have to essentially go back to school as a registered dietitian and spend approximately a year, I think is the Ohio requirement. I haven't seen what the current requirements were, but back in the day that I was told I would need to spend a year in a hospital, essentially working on preparing meals. So that was not exactly what I wanted to do. So I essentially transitioned my website over to selling a lot of vetted nutritional supplements. So if you go to the website now, you'll see supplements that are on there. These are just a handful of supplements that actually have strong science behind them. And about 2 years ago, I went to a business building convention where they essentially look at what you're doing and give you suggestions. And one of the fellows at the convention, well, we had an appointed time where we'd spend and get essentially debriefed and interviewed on what our goals and objectives were. And I essentially told them what I've just told you and your audience. At the end of that, the fellow that was in there, I don't think he called me an idiot, but he actually said, do you realize that your website is #1 in the naturals on Google for the search term nutrition advisor, but you don't do nutrition advising on the site? Because I don't personally. I mean, my picture's on the site, my credentials are on the site. I have people that call me all the time asking for nutrition advice, but I tell them that in the state of Ohio, I'm not licensed as a registered dietitian, so I can't really give nutrition advice. So there was really no way to monetize it. And they said, but you're #1 for the search term nutrition advisor, so why don't you make a compendium of credentialed nutrition advisors on the website? So recently, when Jackie came aboard, which is just a number of months ago, we're in the process of transitioning it over. Now, I still have products on there because those still pay the bills. But right now, the ultimate goal is to remove all products from the website and make it simply a compendium for nutrition advisors to actually list themselves on the site. They can get on there. We actually have a free option right now, which gives you less bells and whistles, but we have several paid options that are on there. And credentialed nutrition advisors can get on the website. They can post their practices on there, and there's a map on the site. And if a potential customer is searching on nutrition advisor, which they do all the time, and which I get questions about it all the time, they can post their websites on there, and the individuals can call them directly, and they can essentially practice their nutrition. And right now we're limited to the United States, so all the 50 states are on there. And so if any of your audience is a credentialed nutrition advisor, we encourage them to come to nutritionadvisor.com, and it's advisor.com. If they misspell it, I have the misspellings on there too. They'll get to the right site. But and they can register on there, or if any of your audience is looking for a nutritionist, they can actually click on there and search the map and find someone that's nearby in their state, and that's the ultimate objective.
So I'm curious as to how you define credentialed advisor, because as you said, one of the reasons why I never went down the rabbit hole of becoming a registered dietitian is because I know darn skippy that I'm not going to adhere to any of the things that they're telling me to do. And so
Exactly.
why waste my money in that? But I got credentials in other areas, you
Yes.
know, because I'm just a lifelong learner and I just want to be able to serve the people that I work with as best as I can. So I'm curious as to how you define credentialed.
Well, any credentialing agency. So anyone that has an ND, obviously a registered dietitian will take as well. But anyone who has and when you go to the website, there is a number of different credentials that are there. But if they're recognized in their state as having a credential to practice nutrition, we want to make sure that this is vetted in some degree. We don't want somebody on there that just says, "Hey, I'm a nutritionist, and I went to the well, I'm in near Columbus, Ohio, so I went to the Columbus, Ohio Nutrition School. Well, there isn't one, but there are other organizations here in Columbus that are credentialing organizations, but none by that particular name. So as long as they have a credential where they can legally advise someone in their state on nutritional matters, we'll take them onto the website. And even if someone is an RN or an MD, those folks typically, because of their degrees, don't often get into nutrition. For one of the reasons is that many MDs and DOs are not compensated for giving nutrition advice. In fact, if you go to your doctor today and you say, "I have this problem," well, if your doctor says, "Well, there may be a number of nutritional products that are good for you," if he or she gets into that, they all are compensated today, most of them, through a system called an ICD-10 code, which is when your insurance company pays, they have to see the code. There are only one or two codes for MDs and RNs and DOs that have to do with nutrition, but it's typically nutritional deficiency. So if you have pellagra, if you have beriberi, if you have any of the deficiency diseases, they can code for that. But just for them to tell you to take this herb, this supplement, they are wasting their time. They don't want to talk to you about it because that 15-minute discussion is not billable, and there could be another patient behind it. So we don't have right now any MDs or DOs in the compendium. I do know there are some out there that deal with it, and some that have really launched into the nutrition business, like Joel Furman. He's an MD. He's a credential. I'd be happy to take him on board, and we'd love to have him as part of the compendium. But most of the MDs that are into nutrition have these huge followings, and they don't really need much advertising, and folks know how to find them because they're all over the internet. So we're looking for folks that essentially have some credential and are interested in being found by potential patients.
Okay. So what do you find is the mistake that people make when they're looking for a person to help them in this area?
I mean, I can speak to that. With looking for my son's information, just when you type in allergist or natural allergist, you get an Angie's list of people that have out-of-date phone numbers or no address, or there's no information behind it other than the name and the phone number. And so you literally have to cold call the list to even determine what's their mission, what's their view on medicine and pharmaceuticals and all the things. There's no way to find out somebody's practice and how they view allopathic medicine, how they view pharmaceuticals versus nutrition. And so this is why the website's so beautiful, is that you can, a doctor's an office, if you pay just a little bit of your marketing budget, which it's nothing per month, you could actually put articles on how you believe vitamin C would work or the amounts. You can post information to bring business to you, as well as helping to inform and create an article or a website base of references. So there's that ability too. So, and as Steve was alluding to with the MDs, I mean, some of the MDs, my neighbor, she's an RN and she's on the actual website. But she has her certification for functional medicine. Yeah. So as you do, so, you know, those are the kinds of things, biologic dentists, chiropractors, people that want to try to solve things without pharmaceuticals, really. And we can't necessarily put that on the website directly, because then we might be shadow banned or blocked or whatever the case is. But in the end, that's the type of credentials that he's looking for, is those types of providers. And they can be all over the map: homeopathic, naturopathic. I mean, I'm sure you probably even accept some, you know, the acupuncturist, whatever, as long as it's a credential, right? So it's something that
absolutely
focuses more on the natural healing of the body. And so to search for anything on the internet, it's very difficult. And I know personally, my pastor's going through pancreatic cancer right now, and he actually drove all the way to Indiana for a naturopathic doctor that tests your cancer with hair and works on it with supplements and healthy eating. And the guy's not even on the internet because he can't be, and he doesn't want to be. And so the only way that he was found was by word of mouth. Wow. And so in reality, that's a lot of our field is the non-allopathic field, is by word of mouth. And we need to fix that. We need to create an environment and a place for that information to be shared.
So now, what do you do about providers who are virtual? Because a lot of my colleagues have shifted out of the brick and mortar, have shifted out of the insurance model and all of those standard systems, and they have become virtually based as advisors. They're not quote unquote nutritionists or anything of that nature, but educators. You know, for instance, one of our board members, Dr. Kelly Sutton, her licensure was taken away from her in 3 different states. So she has created a very different paradigm, and she works with people virtually. How do you deal with that on your site? Because when I was trying to register, I was like, it's asking me for a physical location. I'm like, I can basically do all of the United States. How does that work?
Well, you can actually, it does, and right now, because this is the early phase of the site, and that's an excellent question. We could probably modify it to have a point put in there on the actual location. I think one of the reasons that we have several paid options and one free option that's on the site right now, and we're opening it now for people. If you just want to get on there for free, there are less things that you can do for free. For instance, if someone has a paid option and they have a white paper that they want to post, we'll post it on the website. It'll give the individual some real recommendation. At this point, most of the white papers that are on there are ones that I wrote, so I'm getting tired of doing that, and I'd rather have lots of folks that are writing interesting topics. That's an excellent point. And as far as virtual, we don't prohibit that. I think the reason for the address is if somebody has a paid option, the pay platform requires where your name, address, and zip code is on there. But essentially, somebody could register with a PO box on there if they wanted to, or their home address, even if they're virtual. Because I don't personally have any prohibition against virtual, because physicians today are even MDs, DOs. Not chiropractors so much, but many of the credentialed healthcare providers are doing are doing virtual types of visits. In fact, my son-in-law is a physician. He's an internal medicine specialist here in town, and he actually looked at the possibility of doing that. And there's a lot of folks. Yeah, you're correct, Michelle, who are going into the virtual environment, and especially when a physician needs to do things that are a little bit more difficult to do virtually, but a nutritionist, we can get face to face with somebody, and they can discuss some of their complaints, and we can do that very easily in the virtual environment. So there's no prohibition against it. We probably just need to put the little checkbox on there that you do things virtually, and that your area is the entire United States. And so that's a good point.
So how does that work from a consumer standpoint? If I go into the website as a consumer, how do I find someone, not based on my geography, but rather based on certain things that I'm looking for? I don't want to be limited to my geography. I just want to find the best person to deal with my particular issue, regardless of where they are in the United States.
What on the website you can actually put your the address of your own website on there, so that they can go there. We actually do ask some bullet points about what you do deal with. The idea of virtual is something that we probably need in the next generation of this, to put that on there, so that there can be a link to essentially that covers the entire United States. These are individuals that do it virtually. So that's an excellent point, and something that in version 1 of this we haven't really considered, but it's something that absolutely I'd like to get on there as soon as possible. So that's an excellent point.
Now, Jackie, I want to jump into what you mentioned. You said that, from what I'm hearing, you practically interviewed people when you were looking for a provider for your son. What were some of the questions that you asked to put them on notice? Hey, I'm paying attention here. What are the questions that you needed to ask?
Honestly, I'm not so sure I even got to the interview phase, because I think I called 3 to 5 phone numbers, and 2 of them, or 3 of this was a while ago, but 2 or 3 of them were a non-working number, and then and then I think I got to one, and it was clearly a Riverside big name hospital or organization, and I was like, yep, nope, not gonna do that. Because so in the end though, because I get seen on base at Langley, so in Virginia, and I had a referral to an allergist on base, and when I actually talked to them, all they were going to do was do all the patches and all the chemicals. And so I never followed through. So I never did it, because he's already had so many chemicals in his body that I know too much now. But to go back to your question about searching though, if you go and under find an advisor, you can click all regions, all sites, or specifically do a drop down of what type of doctor you're looking for. So it is something that we'll need to refine for the virtual part, because the initial intent was to make sure that people actually existed, and it wasn't somebody from overseas saying that they were an advisor. So that was the initial reason for the address. But in the end, you're absolutely right. There needs to be a virtual tab that of providers available.
But I also like that you are anchoring in on people who have a legit space, because what I've shared with clients of mine, or just people in general, I said, when you're researching a provider to work with, go onto Google and do a search and see if they come up with an actual physical location. If there are Google reviews, go to the Better Business Bureau to find out if this provider is actually legitimate, because unfortunately, we're in this space where anybody and his mama can go out there and say, oh, I'm an advisor, or oh, I do whatever. And it can be very scary in some ways, and yet in other ways it can be freeing. But with freedom comes a lot of responsibility and a need for you to do your due diligence. So I would love for you to talk a little bit more about how people can find the right providers that are actually going to help them and not just simply milk them of their money.
Take their money. Yeah.
Mm.
Well,
Jackie, you went through this process, so why don't you go ahead and talk to that question?
yeah, I just on the functionality of his site enables all the reviews. It enables the collection of all of the data from people who have been to those providers. So it is a process that's going to take some time to build up for that continuity and trustworthiness. But it's built in. So Steve has built in that function for people to be able to report on what it is that they experience with these providers. But that's also the other part is those wickets that you do have to meet with the credentialing, because like you said, anybody could be sitting in their basement providing nutrition advice. So
as long as they're credentialed, I don't care where they're sitting. So.
Yeah. But So I mean, I'm not a credentialed advisor, and yet I do give advice to my friends, but they listen, but that's my friends.
So will it initially populate the Google reviews or the Better Business reviews while you're
well, we can populate. Actually, we have, I think, at least two, maybe three that are on there right now where they've already received ratings. Most of them are very high ratings. One was a 5-star, one was a 4-star, and I can't remember what the third one was. But they're the people that attend and those particular practices can actually rate them on there. As Jackie mentioned before, a lot of the numbers that she was calling were non-working numbers. So customers actually can say, hey, this number, they can actually report it on the website that they can click on it and say, this number is not working. And we can reach out to that particular advisor and say, hey, what's going on? Has your practice closed? So that can be noted on there. So we do have a number of different feedback mechanisms. Google reviews, essentially, I don't think Google would allow us to review any of the folks that are on there, but Google could probably review those individual sites. I know that we have a Google review and a number of other reviews as well. So that's important. I mean, my business is rated A+ with the Better Business Bureau, but I'm not a member of the Better Business Bureau because I never want to pay the $300 to be it. So you can actually find us online with the Better Business Bureau with an A+ rating, because we've been in business since 1997, and we've never had a complaint that's gone into the Better Business Bureau. And if we did, take care of it. So I mean, there are organizations out there right now that really can vet the reliability of the different organizations, and hopefully those are in place in our listed advisors.
Wonderful. Well, I am just grateful that you guys are doing this, because as you know, it is hard to find someone that you can trust to work for you and for your loved ones. And I love that you are reaching out to providers like myself for us to connect with other people that we do know, to get onto this type of directory, to spread the word, and to make ourselves available to our community. There's so many people that are hurting, so many people that are suffering needlessly because they just don't know who to trust. They legitimately do not know who to trust. And they feel like they have no choice but to keep along in the particular system that we're in right now. So thank you guys for what you're doing.
Thank
you. No, thank you. Let's just grow this network, because
absolutely
get the word out. Get the word out.
So ladies and gents, if you look into the show notes, you're going to see the link to nutritionadvisor.com. And I'm asking for you to go onto that website as a consumer, and also to talk to the providers that you are working with. If you like who you're working with and you think other people should know about them, please recommend that they go to nutritionadvisor.com and become a part of this new special launch. So until next time, my lovelies, I wish you peace.
Thank you so much.
And blessings.
God bless.
Thank you for tuning in for this episode of Mommy Heal Thyself. If you like what we're doing here, please share, subscribe, like us, and leave a comment. Your feedback is very much appreciated.